I am Dr. Amit Aggrawal. I am a senior neurologist in Amrita Hospital and I am an epileptologist also. Today we will discuss about certain aspects of epilepsy, and I like to first start what is epilepsy. Epilepsy is a chronic brain disorder which has the propensity to produce seizures. Seizures and epilepsy. Epilepsy is a disease and seizures are the symptom. Now when we talk about the treatment options, and some people ask, is my epilepsy curable or not? So depends upon person to person and depends upon the type of the epilepsy they are suffering from. If the patient has an age dependent epilepsy syndrome, then after attaining certain age, the patient can be regarded as seizure free and epilepsy free. If a patient has been started with one episode of seizure and he has been started with medications and he has been seizure free for more than 10 years and without medications for more than 5 years, then we can say that he is cured of epilepsy. So when we talk about epilepsy, we should know what are the treatment options. So first is to categorize the type of epilepsy, whether it is a focal epilepsy or it is a generalized epilepsy. Because the treatment options changes when we talk about focal epilepsy and when we talk about generalized epilepsy. So we should know which type of epilepsy we are treating and the patient should know which type of epilepsy they are suffering from before they start on treatment plan. Once we start some medicines for a focal epilepsy, there are two options. One, the patient may become seizure free and then we can talk about cure of the epilepsy. Second, the patient may not be controlled with one episode or with one medicine of, then we add another medicine or we change the medicine or we increase the dose of the medicine. After these three combinations, even after that, if the patient is not improving, that means that we have tried two best medicine for his epilepsy type. Then we consider that the patient is drug resistant epilepsy and the treatment plan changes for this type of patients, which constitute around 30% of the total burden of the epilepsy. So suppose if I am seeing 100 patients in my OPD, 30 patients will be which will not be controlled with more than two medicines. And in these 30 patients, I will counsel the patient to go for surgical option. For surgical option, we need to first find the focus where the seizures are coming from. And if we succeed in finding the focus, then definitely when we are sure about no deficits after the surgery, then patient is counseled for epilepsy surgery. And with epilepsy surgery, there are patients, not 100%, but there are patients who become seizure free and who are medicine free also. Thank you.